Good evening, everyone. Thank you for joining us in this week's episode of Building Better Business, a practice management web series brought to you by FASOMA. In today's episode, collaborating with physicians, with our speaker, Chase Howard, we are going to be sharing some information on the changing landscape of Medicare and how that is influencing how acupuncturists are being affected when working in hospital and clinical settings. My name is Natalia Morrison, and I am the Director of Communications for FASOMA. And just like you, I'm also a licensed acupuncturist. So before we begin, let's go over some housekeeping. This episode is being recorded and will be available for you on our YouTube channel. Be sure to like and subscribe to our channel to see all our videos and be notified when new webinars are posted. Please note the information shared in today's episode by the speaker is for educational purposes only. The views expressed by the speaker are those of the speaker and not necessarily those of FASOMA. We will be holding questions until the end of today's presentation, so please make sure to submit your questions in the Q&A icon that you can find at the bottom of your screen. Chase, thank you so much for joining us today. I'm very excited about this topic, and I'm sure that everyone that is joining is going to find the information that you share with us very, very useful.
Yeah, it's my pleasure. Thanks for inviting me back. I know we've done a couple of these over the last, I guess, year now. Yes. So it's been a really fun collaboration, and I'm looking forward to some more. I'm looking forward to tonight as well. Well, a little bit about myself, and then I'll kind of jump into it. I'm a healthcare attorney. I work with a lot of different types of healthcare businesses and professionals. In the state of Florida, but also throughout the country, just depending upon what the issues might be. I'm at the Florida Healthcare Law Firm. We're a boutique healthcare law firm based in Delray Beach, Florida. And we help people with questions about, how to start a practice, or what's legal, what's not, what are the rules about, Medicare and billing insurance, even things like trademarks and lease agreements. So we're a full spectrum healthcare law firm. We all have different areas that we focus on. So when one of us doesn't know something, you've got, a really good team behind you here that, we can find the answer for you or have the answer. So with that, I know a lot has changed over the last, year and a half, not just with COVID and everything. And it seems like Florida's, somewhat back to normal. So there's not too many emergency, governor orders that are out there that are, all over the place, right? So, hopefully we're getting back to a place where practice is a little bit more normal. But with that, the opportunity to bill Medicare is something that's, I think, new and exciting, and still just that, it's new and exciting because we're always waiting for, more guidance from the Center for Medicare, so CMS. They don't put out too much too often, but we try to figure out what they're thinking and do our best within that, or within comparative fields. So just to kind of recap, and I'm sure most of you know this or have heard it, but Medicare Part B now covers up to 12 acupuncture visits within a 90-day window, and that's for chronic low back pain only. Medicare won't cover acupuncture for any other condition other than chronic low back pain. I'm not certain of the efforts to expand that coverage. I'm sure there are. I'm sure there's hopes and talks for as helpful as acupuncture treatments can be. But for now, it's just chronic low back pain. There's even further restrictions on what chronic low back pain, is defined as. And so that's lasting 12 weeks or longer, having no known cause, meaning it's not related to, cancer. It's not, pain associated with surgery. It's not pain associated with pregnancy. So I guess it means, old age, and, it is what it is, right? I don't even know if the patient can tell you that maybe their bed, is causing it. It has to have no known cause. So it's really restrictive. It's seemingly a high threshold to meet. But I think the way to really make sure that you're doing things right is, come up with processes, policies, and procedures for how you approach patients that are, going to be utilizing this Medicare Part B benefit. Things like, understanding or knowing, how to ask the right questions as far as, how long have you been experiencing this pain? Where are you experiencing this pain? Does anything cause it to flame up? Things like that. And then, wondering what the cause is. And if they say that they know what the cause is, you've got to document that. And I think you've got to let them know that this might not get covered because there's a known cause of it. And, whether they say I had surgery or, I was, now I'm pregnant, et cetera. So, knowing how to ask those questions and knowing how to document it, I think is really important. And that's really, not only for your own protection, with patients and liability and malpractice, but Medicare is going to get into your life now, or your business life at least, once you start asking them for reimbursements. And so they might ask for notes, and they might audit, and they really want to see everything, and they don't want to be paying for something that they don't think is covered. So really thorough notes, really good process for, how you treat and handle the patients that come in with this type of pain or with this type of request, and I think you'll be in a good position there. And you're going to see, I think, a big change, or you should see a big change in even the population of patients that you're seeing. With Medicare, it's going to be an older crowd. And once you are working with, either a physician to do it or a nurse practitioner, when you're signed up with Medicare, you've got to accept Medicare. So, it's hard to turn them away. You got to be aware of what Medicare requires of you. Although acupuncturists are not considered participating providers, you still need to be aware of, of what's required of you, right? And in addition to that, what the federal regulations in regard to kickback laws say. So now that you're dealing with this new beast of Medicare and government payers, there's a lot more regulation on how money moves around, on how you market for patients, on how patients are referred to you, if you pay for referrals. So being aware of that, I think is definitely it's definitely going to be a challenge, but it's something that I think it comes with the benefit of Medicare, and you'll benefit from that. You just got to be aware of it, and it's doable, and it's something you can navigate for sure. Natalia, I know you said we'd wait till questions at the end, but I'm happy if anybody has something that pops up, feel free to shoot it in the chat, and I'll try to answer it, or you, Natalia, if you have something that comes to mind, feel free to interrupt at any time. It's no problem.
Yeah. So with Medicare Plan B, as far as I understand, you have to be working with an MD, and an MD has to be hopefully within that clinic space that is able to sign off on those treatments, correct?
Correct. So still, acupuncturists are not considered by CMS as Medicare providers. And so you're not eligible to bill directly for those services. However, the way to do it is to collaborate with a physician. I think although it hasn't been fully fleshed out yet, there's a new law for nurse practitioners. They've been granted autonomous practice in primary care. So that's probably going to follow. So for now, it's clear that it's just physicians, but it's probably going to be nurse practitioners as well. So collaboration with those types of providers. So you have to work with them and provide acupuncture as what CMS calls auxiliary personnel. So you have to be incident to a physician's services in certain settings, private practice, hospital, pain, primary care, et cetera. Those regulations require a certain level of supervision, which isn't, again, clearly, defined or laid out, but it requires a certain level of supervision by a physician, or an NP at some point. And basically, we understand it as you've got to be under direct supervision, which usually means that the physician is immediately or very quickly available, to help, to provide assistance, and to provide direction throughout the procedure. So that supervising, physician or provider has to be somewhere within, I would say, the building, but probably not the same room. And then once the service is complete, in order to bill for it, it has to be done through, the physician's license, essentially. So, the good thing about that is that, there's some, spread and risk of, there's some spreading out of the risk of dealing with Medicare and liability with patients anyway. The downside obviously is, you can't just open your practice and, start doing it and billing. You have to have some sort of supervision. And obviously that's really tough to, figure out. So, one of the things I'll talk about in a few minutes is, how do you go about actually collaborating with physicians or nurse practitioners? We'll talk about contracting them, lease space, and things like that, whether you should be employed or contracted by them, whether you should contract them. So yeah, it's unfortunate that it's so restrictive. But obviously I think it's a good first step towards hopefully being recognized by CMS as a Medicare provider, solely.
Right, and hopefully, like you said, this is the first code or diagnosis that is accepted because of the research that has been conducted. And I think we can only go up from here. There's hopefully in our future going to be more diagnoses that are going to be covered, which will allow us to be able to help and serve the community more, not just for low back pain.
Right. Yeah. With everything, I think it's, it's one step, and when, there's backing to it and there's studies that show it, it's hard to say no. It's nice to have access to Medicare, but at the same time, you can still provide really great treatment and, be paid for it. Obviously, if people have insurance, it's a nice benefit that it's covered. So, right now it's early on. I think it's going to, continue to expand and change, and that's just, the way it's going to go. But in the interim, you still have obviously great options for, cash pay practices and, the ability to actually help people.
Yeah.
Yeah. And what I mean by that is there's headache that comes along with, dealing with insurance. So
all the paperwork.
Yeah, paperwork, and like I said, audits, and, being aware of regulations, and, referring someone the wrong way is, really, could be a recipe for disaster. So we'll put out some more content, and maybe a more in-depth article on what those, kickback laws really are. But yeah, it's a double-edged sword. You get something good, and something bad, of course, has to follow with it. But I think overall it's good, and overall it means that there's progress and potentially more opportunities in the future.
Yes, agreed.
So I mentioned reaching out to reaching out to physicians, because you can't go open your practice on your own and then bill for Medicare, you have to have this sort of level of supervision and collaboration. You've got to find a physician that is willing to work with you and collaborate with you. And maybe that's in a hospital setting, but it's probably more likely in a private practice setting. In a hospital setting, I think it's a matter of finding a hospital that wants to offer those services and see how you can somehow be contracted with them, whether on a independent contractor basis or even employment, if that's what you'd like. Obviously, there's considerations for both of those, and I'll talk about that. But I think that's kind of a straightforward way in is through hospital services. But what I think the majority practitioners will do is work with a physician in a primary practice care setting. And so how do you approach a physician who maybe isn't offering acupuncture services? If they are, maybe they're already more open to it, and it's something that you can come in and do, and they can do different things and bill for different things. But if they're not, I think you have to do some market research, almost like if you're opening up a business somewhere, which you are opening a business, but if you're opening up an ice cream shop, you want to know how many people in that area are interested in eating ice cream, right? And it's probably a lot, but that you got to do the same thing with physicians. And I think find out who might be a good fit based on their practice and specialty, based on maybe who they're already contracted with when it comes to insurance, and see who else and what other services they already offer. Really the best way to start a conversation, I think, is just reach out to them, ask them if they might be interested, and then formalize that a little bit by maybe sending them kind of a written offer and say, hey, I know we've had this conversation, sounds like you're interested, I'm obviously interested, here's 5 or 6 points that I think we need to be on the same page about, and then maybe we can move forward with some sort of engagement, whether that be employment, whether that be independent contractor, whether that be leasing space, and having some sort of supervision contract in place. So all of those, I think, are options, and it's really something you'll have to talk case by case with physicians. So once you get through that offer letter, I think you'll have a good idea of are we on the same page on a couple of big points, and what are those points? Like I said, are you going to be employed, or are you going to be contracted, or are you going to lease space and do some sort of hybrid of the two? Are you going to pay them for their services and their supervision, or you being there, is that just a big benefit to them and their patients, and it's something that they don't need to be compensated for? If you're leasing space, what does that look like? Are you going to come in there 2 days a week, or 3 days a week, or 1 day a week? What type of marketing are you going to do to show that now there's a new service that's covered by insurance that's being offered? And then maybe even talking about what office policies and procedures you want to have in place that you'll agree on, both for collaboration and making sure that you're screening patients appropriately. So I think that's kind of the first step, is make sure some of those big points are in place, and then once it is, then you can move towards a more formal kind of agreement that really memorializes either an employment opportunity. So you'll talk about like salary, if there's ways to terminate, things like that, or being an independent contractor, kind of the same thing. Or if you're going to be leasing space from them and having some sort of collaboration agreement as well, what that looks like. How much space are you leasing for how much, and how many days, and what supplies are being provided, what are you bringing, what are they providing, what staff can you use for scheduling and things like that. So then you'll get kind of into the more nitty gritty with things like that in those contracts. So I think that's a really good way to kind of get into the approach of it all. was working on something with another client, and we wanted to talk to, one specific industry and, hit as many, providers in that industry as possible. So we went to, different associations and boards that, govern that specialty. So, that's also a good, I think, place to start when you're trying to find somebody that's in your area, or maybe an area you're moving to. And then kind of reach out from there, or see if that board or association has contacts, or if it's something they've even discussed. And if they haven't discussed it, then maybe it's something that, as an individual you bring it, or as an association, it gets brought to them and say, hey, here's what we can do now. If you want to collaborate, here's a directory, or, let's make connections. Or vice versa. You educate that association or board on it and say, I'm available if somebody's interested, please, let's make a connection. So that's the big thing there. For most of you that are in maybe private practice already, I don't know that going to be employed by the physician, might make sense. So I think it might be some sort of hybrid between leasing some space and having a collaborative agreement. Or either them or you contracting as an independent contractor to, treat these patients in this certain type of way. Excuse me.
Right, because when it's the MD that is going to be signing off, so it's under their Medicare provider number, and
Right.
then they're the ones that get the reimbursement from the insurance company, or payment, I should say, from the insurance company for that service. So not you personally get.
Correct. Yeah. So, right. So because all of the billing has to go through the physician, there has to be some sort of agreement in place that shows how you get paid for rendering those services. The physician is going to get paid from Medicare, and then have, this pot of money that they need to do something with. And maybe 100% goes back to you, or maybe it's, whatever percentage you think of, because you're going to use their space and be given access and things like that, or use them as a collaborator. So I think it's, well, I know it's obviously a new area, and there's not a lot of, data as far as, what do those splits look like, and, how much, is it worth to go in per patient, and or per reimbursement, or is it per code? And we'll have to figure that out and kind of go from there and set some standards. But yeah,
Well,
I
because I know, I might be wrong on this, but I believe the fee splitting part is very, it's not,
so,
I don't know how to say it, but
yeah. So
not a good one.
Florida has a kind of unique prohibition on fee splitting, and fee splitting is essentially, when two professionals split a fee for a patient, and only one of those professionals actually saw the patient. That's kind of the broad sort of, view of it. It's really, it's not something that's heavily regulated. It's mostly memorialized through Board of Medicine, cases. So there's not a lot of there's not even court cases about it. Obviously, when there's multiple professionals in a practice, everybody is going to benefit in one way or another, and there's services that are going to be provided. And that's really what's important about having an agreement in place to show, okay, here's why we're splitting the fee, right? We're not splitting it just because it's 50-50 and, that's it, but we're splitting it because there's, 10% to overhead, and 10% to staffing, and 10%, to, being a collaborator, right? And that's how you get to a 30-70 split. So attributing those fees to, expenses of, we'll call it the physician for now, is a really important step. And if there is ever an inquiry by Board of Medicine, the best way to defend it is to say, hey, no, here's our contract, and it shows exactly how we were doing this, how I was getting paid, how they were getting paid, and then we followed that. So yeah, that's something to be cautious about. You can't just, freely split the fees that come in. There has to be some sort of rhyme and reason to it. and really a contract in place for that. In regard to the contract, at the bare minimum, it's a agreement that says, we're going to collaborate, and here's what the fees look like. Depending upon obviously the type of relationship you decide on, what works, it's going to change from there. Currently, there's nothing that needs to be submitted, to the Board of Medicine. Right now, for example, some nurse practitioners and PAs, when they're supervised, they have to submit something to the Board of Medicine, but that's not happening with this. So everything's really private between the two parties. But still, it's important, like I said, for fee splitting purposes, but also, if you ever have a dispute about, when you're coming in to see patients or things like that, or when you're using the space, or, what the pay compensation is, it's important to just have that memorialized and kind of have something to fall back on. And really, when you're dealing with, federal payers, it's good to have, all types of documentation of the relationship you're having and what's getting paid and things like that, because if they ever audit you, you want to really make sure you have something that you follow, obviously, that actually shows that, you're doing things the right way.
So that takes me to a question that was submitted. If you are an independent ARNP and licensed AP acupuncturist, would you still need to collaborate with an MD for this?
So if I'm understanding the question correctly, and maybe I'll answer it in two ways and I'll assume, but if you are a licensed advanced nurse practitioner, and you have autonomous practice, and you're also a licensed acupuncturist, do you still need a medical director or a physician to collaborate with? If you are those two licenses combined, no. And the reason it's no is because an autonomous nurse practitioner is able to, under their license, perform acupuncture. And if they're autonomous, this is where it gets a little bit gray, but these services are going to, I think, fall under this. Autonomous nurse practitioners can only practice autonomously in primary care practice, which is defined by the Board of Nursing, and it deals with, chronic, pain and issues and things like that. So, my answer would be, as long as those licenses are, on the same person, they're going to use their NP license to do everything, because they can perform acupuncture through that. If they are separate, and if the question is, can an AP utilize an independent nurse practitioner, an autonomous nurse practitioner? Like I said earlier, it hasn't been defined. That definition hasn't been changed yet with CMS, because CMS is federal, and Florida is Florida, and so the autonomous nurse practitioner laws are specific to each state. This one in Florida, is fairly new as well, really last year. So, I don't know that they're going to change anything. They may include definitions that say, autonomous nurse practitioners in certain fields. I think there's a lot of, kind of explanation they could still do to get there. But as of now, nurse practitioners, I don't think are going to qualify to be that collaborator. Physicians are, but if you want to go down that route, you might be the first person to do it, and you'll be a test case for it. And I don't recommend that, but I think that's the way it's going to go at some point.
Wonderful. Thank you for answering that. So just a reminder, everyone that is joining us, please submit your questions, and we'll answer them as Chase continues with his sharing of information with us tonight.
Yeah, feel free to jump in. I think one or two other things I could talk about is going back to Medicare specifically, and the types of settings. I don't know if this is something that licensed APs need to figure out, or if it's collaboration, to use the term. But going into a hospital setting, for example, there's a lot of things I think you need to consider, just like going into a private practice, but that might be a little bit easier to set up and do. But if these procedures are going to be done in a hospital setting, ideally I think you'd want to have some sort of designated space for it, or wing for it, right? You don't want to be in an ER trying to provide relief to someone, whether that be a more calm environment. So I think it's a consideration that everyone's going to have to think of, is as all these different licenses start to collaborate and provide healthcare, how do we change the space that we're in as well? I don't know that every hospital is going to be well suited for a designated space. Maybe larger ones are, or maybe it's more of an outpatient setting connected to the hospital, which I think is going to have similarities to a private practice. And something else that you might need to consider is this is me speaking from ignorance, because I don't know how to do these procedures, but what type of recovery or additional therapy, or post treatment procedures can go along with this. Maybe that's obviously built separately, and it's billed directly to the patient, and it's cash pay. But when you're in an outpatient setting, or primary practice or private practice, what else can you do, or are you going to do, and what do you need to accomplish that? And to jump back to contracting with a physician, talking about those things in your agreements, I think, is important too, to say, not only is it one room for this, and we're obviously going to bill Medicare, but here's the other list of services that we can provide that really will help and show improvement on these treatments. And I think that's a really good thing to figure out, because if you want to get past those initial 12 treatments, you have to be able to show that there is improvement, signs of improvement on the patient,
Right.
so you can provide up to 8 additional treatments. So I think anything you can do to show or to help with improvement, even if it means hey, for 30 minutes after a session, you just relax, right? And that, again, I'm speaking from ignorance here, but maybe that helps, right? And so can you provide a space for a patient to do that after a treatment, and really let the treatment settle in, and and do what it's supposed to, versus the patient getting back up and going in their car, and sitting in a bad position, and re-aggravating what they just tried to fix. Yeah, so I think all of those things are important considerations and stuff to think about, and will be conversations with the people that you're collaborating with at some point.
So the main legal thing that we need to make sure that we are focused on and very detailed on is our contract and our written agreement that we establish with the collaborating MD. Because right now it's only MDs that can sign off on these benefits for low back pain.
Correct. Well, MDs and NDOs. So
Okay.
yeah,
MDs and
yeah.
DOs.
So physicians. That doesn't include chiropractors. It doesn't include dentists. So it's strictly medical physicians. Hopefully at some point it's autonomous nurse practitioners as well. Because really, nurse practitioners and PAs otherwise are working under a physician license as well. So you may be working with them, but it's the physician's license that's going to be billing. So yeah, I think that's probably two big takeaways is obviously understanding what qualifies, what doesn't qualify. And how to create something that ensures that you are doing everything appropriately, so you're only treating people and billing for qualified services to avoid any issues with Medicare. And then kind of the second big thing is the actual practical collaboration, via paper, via document, how to make sure that your relationship with a hospital or a private physician's practice, is beneficial to everybody and makes sense and is great for the patients, and really, covers everybody the way it needs to, liability wise, and from Medicare audits and from patients. And so yeah, I think those are the two big takeaways from this, and and we just are going to continue to wait and see how this expands and evolves.
And so if we don't have a direct connection right now with a clinic or an MD or a DO, you mentioned earlier about reaching out to the medical boards and the associations.
Yep. Yeah. So, for comparison, chiropractors years ago, I think when things changed in their profession and they were dealing with insurance more and more, there's a lot of really good collaboration that chiropractors did with, physicians of all varieties. I don't know, what their recipe was or what the secret sauce was, but I would think it was, they reached out to, providers in their area. If they were smart, they probably also went to local boards and associations, whether it be primary care, whether it be ortho, whether it be pain. Even it's obviously there's some competition with chiropractors, but there's still, I think, opportunity to see who their referral sources are and who they work with and things like that. So I think that's probably the best way, is really just going on a very local level, and then you can kind of work your way up and see who's if they're not on the the Palm Beach County Board or Association, maybe they're on the South Florida Board, or then you get to the Florida, the big Florida Association. So going through there's usually listings of members. There's usually contact people for all sorts of inquiries and questions. I think one person on your own, that's great. If you can push and collaborate as a group, even better. You'll get some sort of, I think, pipeline built with hey, when somebody wants to connect, how do we do that? How do we connect our members to really collaborate?
Yeah, that's wonderful. Thank you for that. I'm gonna
Yeah.
definitely bring that to the board and see what we could do with that, because I think that would
Yeah.
be wonderful to help all of us. Right?
Yeah, I think there's there's strength in numbers, and similarly with when dealing with, and I know this is a little off topic, but when you're dealing with imaging, diagnostic imaging, it's something that can help you as practitioners know how to treat, or know where to treat, or know what's causing. So working with radiologists or imaging centers as well, and that just is a matter of identifying, and reaching out and saying, hey, here's what we can do, here's how we can collaborate, here's how it's beneficial to everybody, and then go from there. And hopefully that works. It's not going to hit with every single person, but there's plenty of people that I think are entrepreneurial enough, and at the same time understand that patients come first, and let's do the best for them.
Yeah, wonderful. Well, thank
Yeah.
you for that insight. Definitely, there's a lot that we can all learn and put into practice after your presentation today, whether it just be picking up the phone or looking up an association or a local clinic and just reaching out. You don't lose
Right.
anything by just reaching out and starting a conversation.
Yeah, I think you've got to ask, and you can't be afraid, and good things will happen when you put yourself out there and ask. And I think that I think the growth in collaborations will show everybody that, okay, let's see what other treatments can be covered by Medicare now. Let's move this along, because there's there's proven, it's something that's attractive, it's great for patients. Let's see what else we can add. So I think that'll just kind of continue to, push the ball along.
Wonderful. Thank you. Well, it doesn't
My
seem
pleasure.
like we've had any new additional questions so far. Yep.
Yeah, if there's any, feel free to, shoot them in. I'm just going to put my contact info here. So if anybody, has a follow-up or question, you can shoot me an email, and we'll answer it, we'll connect. I don't know, Natalia, if you, I'm sure you go over the benefits, and we have a fee relationship, obviously. So
Yes, go
I'll let
ahead and talk about that if you want.
Yeah, so as members of FSOMA, you're entitled to discounted, fees on our end. So first and foremost, you can call in, or we'll set up a call, and we have like a 15-minute sort of free consultation, and it's really to figure out, where your area of need is as far as legal issue goes. Make sure we can help you, and if not, put you in touch with someone who can, and try to answer maybe a question or two that doesn't, put us into anything, too risky. And then as far as, going from there, you'd have to retain us for anything, more serious. But I offer 20% off of my legal fees to members of FSOMA. So, yeah, we'll talk about all that, and we do things on an hourly basis or a flat fee basis, or anything in between that we can to, provide high quality service at a, reasonable, fee for everybody.
Yes, thank you. That's for all our members. So thank you, Chase, for spending time with us tonight. I'm gonna change that. Sorry, the email, if you can do it to panelists.
Yep.
Please. So for those of you that are watching live or watching the recording, Chase at floridahealthcarelawfirm.com. floridahealthcarelawfirm.com. So thank you everyone for being with us tonight. Thank you, Chase. And we will have more webinars with Chase next year on different topics like trademark, hopefully, and copywriting, and a lot more useful legal jargon that
all the fun stuff.
Yeah, that we all need to get to know and understand as we keep on growing our practice.
Yeah, and I really appreciate it. It's always a pleasure, to speak with you all and to have the back and forth, Natalia. So, I'm looking forward to it. We're talking about trademarks and copyrights in the future, which will be great. I put my email on here for those that are here. It's floridahealthcarelawfirm.com. There's a ton of free resources on there, previous webinars, blog posts, articles, links to all sorts of stuff. I think there's even a dedicated page, for FSOMA members. And so you just go on there and eat it all up. If you've got questions, feel free to reach out.
Yes, definitely a lot of useful information. You can spend hours and just dive in and learn. So it's a great site. Yes.
Even I go on and read other attorneys' articles and things like that. So there's a lot of good stuff on there. And to the extent that there's ever, a big question that comes up, feel free to submit them, and we'll do something on it.
Wonderful. Thank you so much again. And thank you everyone for being here with us tonight. We will hopefully see you next time.
Thank you, everybody.
Good night.
Bye.